Can you hear me and see me? Welcome back and good morning for you guys. So let me share my screen here and let me introduce the webinar very fast. Okay. Good morning, everyone. Okay. So I will introduce myself first and then I will give you an idea about what we will be doing this lecture here. So my name is Karim. I am the head tutor at the Match Guy, and I have scored 279 on my Step 2 exam, and I have passed my Step 1 exam, and I have been tutoring the USMLE for about 5 years. Good morning, Osama. Good morning, Iman. Good morning, guys. I believe some of you have been with me in the previous webinars also, the webinar of the neuroanatomy and the hematology, and I hope the biostats webinar you liked it also. So, what are we going to do right now? So, we are going to do two things. I believe you have seen that the main title itself is test taking strategies, and that's half right. We will be doing test taking strategies for step one, step two, and step three. But I believe that what I will also do is that it would be test taking strategies and also studying strategies. So I will show you when I do questions myself as Karim, when I have been doing it for step one and step two. What's the ways I approach the question to get the most out of it and to try to answer it correctly, even if I don't know the answer. And that's why, let me share my screen here. That's why what we will be doing right now is that I will answer random questions from our QBank, which is Synapse. So this Synapse is our QBank. It has the most high yield 1350 questions. I will be answering questions with you guys random. So I am not preparing anything. And the reason I was thinking about it is that I told myself if I am preparing the questions and I already know the answers for these questions, it wouldn't be realistic because it wouldn't reflect how I actually think about the question. I will just give you the ideal way to think about it, but not the realistic way. So I will show you how I answer the questions first, then how do I study this question after I answer it, then how do I narrow it down to few questions if I don't know the answer. So we'll be doing few questions with each other and you will see some of them I will not know anything about it. So I will try my best to answer it right. Some of them I will get it right, some of them I will get it wrong. But I need you to do one thing, and this is a rule. When you are doing questions, guys, I need one thing to put into your mind. If you are going to choose an answer choice, you must have a valid reason for answering it. I am not saying a correct way or a correct reason. It doesn't have to be a correct answer. But at least have a valid reason into your mind of answering this question. Tell me, oh, Karim, I answered this question because of the age of the patient, for example. So always try to answer questions intentionally. Do not try to pick a random answer that's not good, even if you don't know anything about the question. So let's try to do it random. So we'll choose all these things and we'll do 40 questions and we'll try to pick the ones I think maybe can be important, like cardiology, neurology, microbiology, this type of stuff. Okay. So I'm trying to choose ones that can be valid for step one and at the same time for step two also. Okay, guys. So I believe that's respiratory. I do not want to spoil it for you guys, but if you see questions like this, and this question is having an image, the first thing I do to any question is that I look down to the answer choices. And once I have looked down to the answer choices, I already know what the question is asking. So here there is an adenocarcinoma, large cell carcinoma, small cell carcinoma, squamous cell carcinoma, transitional cell carcinoma. So I know they are asking about types of lung cancer. And from the image itself, I already know the answer, but let's read it and see. So they are telling you a person, he is very old with a heavy smoking and alcohol history, present with 4 months history of progressive hoarseness and weight loss. Physical exam reveals a 3 centimeter firm fixed mass in the right neck. So apparently it's not types of lung cancer only. Apparently this person is having a cancer of the head and neck. And then they said it's deep to the sternocleidomastoid muscle, and the laryngoscopy shows a variable mass on the right vocal cord extending into the supraglottic space, and the biopsy findings are shown below. And they're asking what's the most likely diagnosis. So I will give you few time to try to answer it, guys. So what do you think this person is having? This person is having some kind of mass in the head and neck, and they're trying to ask what type of mass is this. So you have two ways to answer this question correctly. Either some of you guys will already be identifying this type of lesion, okay, on the histology itself, or some of you guys will already know from the stem what type of lesion. So what do you think here? So Monsura is saying squamous cell carcinoma, Ahmed is saying keratin pearls, Nelsa is saying also squamous cell carcinoma, Karina squamous cell carcinoma, Rosie, and Antina. Amazing, amazing guys, perfect. So I will tell you what do I think about it. So first, once you look at this histology, you see that there is this whorled cells like this. And this can be two things actually, Paula. The first thing is that it can be a squamous cell carcinoma, because this can be keratin burls. And the second thing, which is always confusing students, is something called the Samoma bodies, right? Because Samoma bodies also looks like this. But mostly Samoma bodies will be mostly word like that. So once I have seen this question, I have seen that this person is having keratin burls. And in order to answer this question, I need to associate in my mind that once you see keratin burrs on the exam, this person will be having squamous cell carcinoma right away. It doesn't matter where is the lesion. If it's in the lung and you see keratin burrs, that's a squamous cell carcinoma of the lung. If it's in the larynx, that's a squamous cell carcinoma of the larynx and the head and neck. If it's even in the esophagus, that would be squamous cell carcinoma of the esophagus. And the three of them will be caused by smoking. Okay, so now I have a valid reason of why to pick this answer. So now I will pick it even if it's the wrong answer, but I have a reason to my answer here. Now, another thing that I wanted to add, Caroline. Let's say you tell me, okay, Karim, give me some test taking strategies. I don't know this histology. Can I answer this question correctly? Yes, you can. How? So this person is having he's a heavy smoker, and he is having laryngeal mass. So if you already know that a smoker person with a cancer and the head and neck, the most common cause of cancer of the head and the neck will be already squamous cell carcinoma. So you have two ways to answer this question correctly. Either you already know the picture, or you already know that the most common cause of the cancer of the head and neck will be squamous cell carcinoma. Now, how do I review the question itself? Usually, the way I review the questions is that I just go very fast into the important stuff. So, yeah, this person is having keratin burls. Yes. This person is also having intercellular bridge. That's fine. So, I go very fast through the most important stuff. Oh, the cancer of the head and the neck most likely drain into the deep cervical lymph node. So, probably this is also an important thing that you can ask about on the exam. Okay, then I also go very fast to why the other answer choices are incorrect, if they are related to each other. Okay, and then I read the bottom line. I always do this, and I always scan with my head, with my hand, and with my eyes into these questions, even if I have seen this question before or similar to it. I always scan with my eyes, guys. I don't skip. Okay, that's very important. Now, let's go into another answer choice and let's see how can I answer it. This one is probably not that important, so we can skip it. This one is also, I want to get a one that's a little bit very large, so I can tell you how do I reach or how do I deal with large questions. So maybe this one is large, and maybe this one also. So let's answer these two with each other, guys. And right now I will be answering it and I will tell you how do I think about the question. So again, what do? I read it from the end, okay? And some people think that when I mean the end of the question, I mean this part. No, this is not the end part of the question. The end part of the question is the part that give me an actual important information, which is usually the last two lines, not only the last line, because what's the last line telling me here? The last line is telling me, oh, which of the following is the most important etiological factor? It doesn't tell me anything, right? So what do I do is that I read the line before it. So the cells at the periphery of the nests are arranged in a parallel fashion, and there is a distinct separation between the tumor islands and the surrounding stroma. So this line is telling me maybe a histological part, okay, or a skin biopsy finding. So that's fine. Then I go and I glance at the answer choices. So there is ultraviolet ray, or radiation exposure, germline mutation in mismatch repair, Epstein-Barr virus, high-risk human papilloma, long-term arsenic. So I know right now they are asking about things that are causing a oncogen or are causing cancer in general, because ultraviolet radiation causes cancer. Germline mutation in mismatch repair, that would be Lynch syndrome, which can cause colorectal carcinoma. Okay, infection with Epstein-Barr, guys. Epstein-Barr virus can cause many cancers. It can cause nasopharyngeal carcinoma in Asians. It can cause lateral hairy cell leukoplakia in the lateral tongue. It can cause Burkitt lymphoma. Okay, so it can cause many cancers, and it can cause primary CNS lymphoma of the head, right, Anthony? And then infection with high-risk human papilloma virus. This can also cause multiple cancers. Primarily, it will cause cancer of the cervix, cervical carcinoma. And then long-term arsenic exposure can also cause few cancers, especially skin cancer. So let's read the question with each other. So right now we know they are asking about a type of cancer and what's the cause of it, right, Nelsa? So a 74-year-old man comes to the physician because of a slowly enlarging painless lesion on the bridge of his nose. So right now I know they are talking about a skin cancer, right? And because I have a pattern recognition, I know once they are mentioning a skin cancer and it's in the nose, I know it's mostly basal cell carcinoma because I know the word that's saying BC. Basal cell carcinoma is usually in the upper lip, and the squamous cell carcinoma is usually in the lower lip. So if the person is having a cancer on the nose, that's mostly basal cell carcinoma. But let's not go very fast. Let's not presume things. Let's continue and see. He first noticed the growth approximately 18 months ago and notes that it occasionally bleeds after minor trauma. This also adds that it's a basal cell carcinoma because usually basal cell carcinoma, guys, will have something called telangiectasia, and telangiectasia means small blood vessels. And these small blood vessels bleed after minor trauma. So now I have two things that tells me it's basal cell carcinoma, which is in the upper part of the nose and also bleeding after minor trauma. Then he worked as a landscape architect for 40 years and rarely used head covering or sunscreen. This tells me that he has been exposed to sunlight, and we know sunlight can cause skin cancer in general. Okay. Then they said there is 0.7 centimeter barely translucent babule with prominent telangiectasias. You already told me this. So I don't even need to figure out that this bleeding after minor trauma is telangiectasia because you already told me this. And the word barely means it's very shiny. And this is also classic for basal cell carcinoma. And something very important I see students do by mistake is that they always know how does basal cell carcinoma look like in a picture, but they don't know the description of it or any dermatological lesion. Guys, for dermatology, it's high yield to know how does the picture look like, but also how does they describe it on the exam. Because sometimes they will show you a picture, but sometimes they will describe it without showing you a specific picture, Paula. Okay, so right now I know from the description, barely and telangiectasia, it would be basal cell carcinoma because mostly squamous cell carcinoma, it will be ulceration. They will say ulceration. And mostly melanoma, they will say pigmentation because melanoma means the melanocytes. So I know it's basal cell carcinoma. Then there is a small central crust. There is no lymphadenopathy, so it's not invasive. Skin biopsy is performed, and they showed nests of basocellulite cells extending from the epidermis into dermis. So this basocellulite cells, guys, is also another highlight for basal cell carcinoma. And the cells are nests that are arranged in parallel fashion, okay? And there is a distinct separation between the tumor island and the surrounding stroma. Okay, so right now I know for sure it's basal cell carcinoma. And I know for sure that it happens from sun exposure. So what should I do into this question? So in this question, I already know the answer. So it happens from sun exposure because sun exposure already have ultraviolet radiation that can cause cancer. So should I stop at this and think, oh, I am the best person at the world because I already know the correct answer, so I don't need to do anything else for the question? No, you will be wrong. Because, okay, now you know that radiation can cause basal cell carcinoma. but there is few things I didn't know in this question and I need to figure out with myself. The first thing I need to ask myself, how does radiation cause basal cell carcinoma? You always have to ask yourself, how does this cause that? So if I know the answer, I will try to answer it to myself. Oh, radiation can cause squamous cell carcinoma or basal cell carcinoma by causing damage to the double-stranded DNA, free radical damage, right, Ahmed? So DNA damage by free radicals. So that's the first part. I always have to ask myself. The second part, I always need to ask myself, what are the other answer choices or what do they cause? Because they have to be related. So I need to know at least each answer choice can cause what type of cancer. Okay? The third thing, can you see, guys, I have read here, oh, the cells at the periphery of the nest are arranged in a parallel fashion. But I don't know what they are describing here. What is this parallel fashion? So apparently I know the answer, but there is something I am not figuring out. What is this histology? So what I need to do is that I need to figure out this histology first. I don't need to skip the question. Okay, so I read the explanation. First, I see the picture. As you can see, it's shiny, and it has telangiectasia. So I know the picture very well. Okay, then I read the explanation extremely well. And then I read what is this histology. So apparently this histology they are describing is called peripheral palisading, when the nests are extending in the epidermis into the dermis. And apparently now I know what is palisading. Palisading is when cells accumulate around other cells like this. That's called palisading. Okay. If I don't know the answer, or if I don't know what is palisading, I don't want you to skip it. No, please, guys, each important bold here is extremely important. So let's say if I don't know the answer, I need to go into ChatGPT or the AI chat. And I believe ChatGPT and the AI chat, guys, will help us tremendously passing the exam and it will save too much time. It's better than Googling. And I will just ask him, what is this palisading? I don't understand it. Okay. And I always have done this. I have done this in step two. Okay. And that helped me getting this score, guys. But I didn't do it for step one because ChatGPT was not in step one yet. I did step one in 2022. Okay. So I know now palisading is arrangement of cells. They line up in rows that resemble a fence, so they are making a circle with each other. Okay, and probably it's a high yield for basal cell carcinoma. And now I know what is palisading, and now I know every important stuff about the question. I go very fast into the other answer choices, and I see. So yeah, the microsatellite is the one that can cause colon cancer, and it can cause endometrial cancer. Okay, Epstein-Barr can cause these types of cancer. Okay, high risk human papilloma can cause cervical cancer. Okay, so I read very fast and I go through the important stuff and I go through the differentiation. Let's say I didn't know in the question, is it basal cell or squamous cell? So I need to figure out what's the difference between them, basal cell and the squamous cell, because apparently squamous cell can cause ulceration, but basal cell will cause this telangiectasia we talked about. So please, guys, answering the question correctly doesn't mean that you know everything about it. And this doesn't mean that you are ready to answer it on the exam. Because maybe the exam will test you on the ultraviolet radiation, but maybe the exam will also test you on the pathophysiology itself, right? Which is, for example, the damage of the free radicals. Or maybe it will test you on another thing. Maybe it will test you actually on Epstein-Barr virus. That's why studying this question is extremely important. Okay, guys? And studying questions in details. Now, I will answer a question from Ahmed and then I will go into the second one. Would you just read the explanation and understand it? Or would you try to memorize new information and actively recall them or take notes? Probably I need to understand each question. And I don't ever memorize them. I don't try to actively memorize them because this will be useless and this will take too much time. I prefer to just understand it very well, and maybe if I need to memorize something to make a flashcard, for example, oh, flashcard that why ultraviolet radiation cause cancer, because it can cause DNA damage. So I will add flashcards, or I can make flashcards, or I can make my own notes. So either notes or flashcards. Then I can review them every day. Okay, guys? Probably 95% of us, they make notes but they don't read it. So I recommend doing flashcards better. Okay, but do not try to memorize right now. This will take too much time from you. Okay, guys, the memorization will come at the last month or the last 2 weeks at the dedicated period, and you will see yourself when you answer too many questions, you are already memorizing this type of stuff. Okay, so do not try to memorize right now. That's very important. Now, let's see this question. I probably this question here is not that important because it's an infection, I believe. So let's go into another question that's actually more important. Okay, so that's also not important. That's cholesterol emboli. I know this from the histology, and you will see, guys. Once you do too many questions, I can already answer any question actually either from the histology right now or either literally I can go with my eyes and I know what matters. I know this person had a repair of aortic aneurysm, and I know after you repair an artery, you can get cholesterol emboli because you can break down the cholesterol atherosclerotic plaque. So I already know these things, but I'm telling you, what should I do if I don't know this type of stuff? Okay, so let's see this question. So I already know the answer because I have read the last sentence, but let's read it with each other and see. So again, what should I do when I see a question like this? I read the last sentence. What's the last sentence, guys? Is it this one? Which of the following is a diagnosis? No, this didn't tell me anything. So that's not the last sentence. The last sentence is this one. Laboratory studies show markedly elevated creatine kinase. Okay? So I know right now they are talking about some type of muscle damage. So this gives me high yield information. So I read the answer choices after I read the last sentence. Oh, dermatomyositis, inclusion body myositis, fibromyalgia, polymyalgia rheumatica, polymyositis. I know they are talking about muscle problem. I can literally exclude right now from just this last sentence I have read because I know fibromyalgia. This one is usually psychiatric problem or functional problem. Okay, it usually cause muscle pain, usually in young females. Okay, this person is a 54-year-old woman and she has increased creatine kinase. It means she has muscle damage, not only muscle pain, not a functional problem. So it's not fibromyalgia. And I know polymyalgia rheumatica can cause inflammation of the muscle and increase in the ESR, but it doesn't cause muscle breakdown. It doesn't cause muscle weakness and increase creatine kinase. So I know it's also not polymyalgia rheumatica. Inclusion body myositis, I know it's probably an inherited condition, so it doesn't happen in 54-year-olds. So can you see Hovzev, can you see Nelsa, can you see Osama? I can exclude three answer choices. Three answer choices just from reading the last true sentence, Imelda. Then I read the remaining of the question just to figure is it A or E. But I know right now this is dermatomyositis, this is polymyositis. Both of them are conditions that that damage the muscle. And I know the only difference is that dermatomyositis will present with rash, right? But polymyositis doesn't cause rash at all. So while I am reading this sentence, Shiranya, what I am trying to do right now, I am trying to do two things. I am trying to figure out is it dermato or poly, and I am trying also to make sure did I exclude them correctly, and am I going into the right direction or not. So that's the two things I'm trying to do. So let's read here. She is a 54-year-old woman. Age is extremely important, okay? Because I told you fibromyalgia, inclusion body myositis, these are things that happens in young people. So you can exclude them by the age. Comes to you because of 4 months history of progressive muscle weakness. Duration and action is important. When they tell you it's 4 months, it's a chronic condition. So it will never be an infection, for example. Okay. She reports increasing difficulty rising from a seated position. This means the gluteus muscles are weakened. It's a proximal muscle weakness. Okay. And reaching for objects on high shelves. So it's a weakness. Weakness. So I know it's myositis because polymyalgia rheumatica will cause stiffness, not weakness. Fibromyalgia will cause pain, not weakness. She also notes a weight loss. Guys, when you hear weight loss, it has different causes. All of them happens from inflammation. Weight loss usually happens from inflammation. This inflammation can be from a tumor, that's why tumors can cause weight loss. This inflammation can be from an autoimmune condition like polymyositis, dermatomyositis. Okay, so weight loss can happen from inflammation in general. So she had weight loss during this time, but denies any recent changes in her diet. Her medical history is unremarkable. She takes no medication everything is fine in the vitals. I need to go with my eyes very fast. I am not reading it in details. Very fast. Temperature is fine. It's not an infection. Blood pressure is fine. Pulse is fine. Very fast. Okay. And respiration is fine. Physical exam shows symmetric 3-5 strength. So that's weakness. So now I am 100% sure. Muscle weakness. That's my pattern recognition for myositis. Myositis is the only one that will present with muscle weakness here. Okay. Sensation to light touch and sin break is intact. It's not a neurological problem in the sensation. Examination of the skin show no rash, scaling, or erythema. So that's the answer here. So this tells me it's not dermatomyositis because this will present with a rash. It can present with something called the Gutron babioles on the fingers and the heliotrope rash, okay, on the eyelid. So right now I know it's not the answer and it's polymyositis. So right now I know the answer is polymyositis, okay? Now I will choose it and I will read these things very well because apparently these things are related to each other. While I am reading it, while I am reading the question, I need you to put something into your mind. Why did you exclude fibromyalgia? Try to read the answer and make sure you excluded it for the good reason, Nelson. Because sometimes I exclude answer choices for the wrong reason and I just answer it correctly by luck. So I need you to make sure to go into the answer choices and make sure you actually excluded it for the right reason. You didn't just exclude it for anything. Okay? So I will make sure I excluded it for the correct reason. First, I read the question. Oh, muscle weakness, increased creatine kinase Nelsa, right? And absence of skin finding. This tells me it's usually myositis, not dermatomyositis. It's usually myositis. So that's the first thing. Then I read the high yield facts about polymyositis. Oh, polymyositis will usually be CD8 T lymphocyte. And I know this. I always tell my students poly means CD8. Poly means too much. So it's CD8. On the other hand, derm, 4 characters, derm. So it's CD4. So dermato is CD4. Poly is CD8 that infiltrates the endomysium. I know bully, endomysium, derm, perimysium. I remember derm is around the body in the dermatology, so it's a perimysium, but bully endomysium. So I always try to make sure I know these high yield facts. Okay, there is also elevated creatine kinase and aldolase. Key association include anti-Jo1 antibody. I need to remember this. Anti-tRNA. You will tell me, Karim, when I see like an antibody or a disease that has two names like this, do I need to know the two names? So do I need to know that, oh, you will see anti-Jo1 and the anti-tRNA? Yes. Usually NBMEs love to always ask about the two names. Either they will present Jo1 or tRNA. And I don't want you to study very well on the exam, but then get the question wrong for a very silly reason like this. So that's why, please, guys, if you see there is a disease that has two names, try to remember these two names. For example, Lambert-Eaton has another name that's called the myasthenic syndrome. Okay, for example, let's say what else? C. anca has another name, which is usually antineutrophilic 3. B. anca has another name, myelobroxidase. So always know these two names, as Osama said. These things, guys, are extremely high yield. These things in bold are extremely high yield. By the way, while I am doing these questions, there was about like 20 to 30 tutors that have written the questions. And me and Dr. Asad was going through these questions and adding these high yield facts. So we were adding, oh, this anti-Jo1 is important, but it's also called tRNA. So we were trying to make sure we add this important stuff. And I need you to remember this important stuff, guys. Okay. Then we make sure we excluded dermatomyositis for the correct reason. So dermatomyositis will cause what? It will cause heliotrope rash and the Gutron babioles, as Nelsa have said, right? It can also cause perimysial infiltration. So I make sure we excluded it for the right reason. Okay. Inclusion body. Oh, inclusion body, I excluded it for the wrong reason, guys. I thought inclusion body affect the kids. I was wrong. It actually affected people over the age of 50. So why it's not right? Because it's asymmetric and it affects the distal muscle. Oh, so the fingers. This person had problems in his glottis. He couldn't get up. So now I know I excluded this answer for a wrong reason, and now I know the right reason for it. So that's pretty important, guys, to know this. Okay. Of course, I knew the right reason, but I was trying to give you an example. Okay. Now, fibromyalgia will be usually tender points, okay? And the polymyalgia rheumatica will be usually proximal muscle weakness and morning stiffness, okay? So that's very important. Now, I excluded B for the wrong reason, right? What would I do? I will go to the flashcards here, okay? So here apparently they haven't written a flashcard for inclusion body because it's not high yield. We were trying to make flashcards for the high yield fact only, but I got it wrong, or I got it for the wrong reason, Kara. So I will add a card, and I will add this card for inclusion body myositis. I will make a flashcard for the one I got wrong. Also, let's say, Kara, I didn't know about anti-Jo 1 tRNA. I will make a card also of it. Okay, so that's the thing. Yes, Hovzev, that's amazing. Yes. So there is many ways you can get a question right. And I always tell my students, you have two chances of getting the question correct. Either you already know the correct answer, or you know how to exclude the incorrect ones. That's always what I tell my students. You have two ways of answering a question correctly. Now let's try to find another way, okay? Can you see, guys, I already know these answers. So non-tender ulcer, I know that's usually syphilis. And I know they are asking about the treatment of syphilis. I know it's penicillin, but I am trying to see if they have penicillin allergy or not, so I can answer the question. Because penicillin is the first line treatment, and I know the first line treatment is probably inhibition of peptidoglycan, which is penicillin, okay? But I try to make sure, even if I know the answer, that they are not trying to trick me. Because do you know what can they do in this question? They can tell you he has allergy to penicillin. So now you will use the oxycycline, which inhibits 30S. I'm just trying to show you how do I answer questions fast and how does pattern recognition is important. I just know non-tender ulcer is syphilis. I know it's penicillin, and I know what are the tricks they can ask about. I know they can ask about, oh, they have penicillin allergy. So the answer will be 30S, which is the oxycycline. That's the second line treatment for penicillin. Okay, guys? Then if there is always a picture for all the important high yield antibiotics, I try to read it very fast. Oh, mRNA, that's rifampin. RNA, topoisomerase fluoroquinones. DNA metronidazole. If I don't know one of them, I make an Anki card right away. So the purpose of this question was not only knowing penicillin, peptidoglycan. No, guys. While we are making this question, or even if your world is making this question, it will try to put you a high yield answer choices. So you know you are supposed not only to study the answer choice E, you are supposed to test yourself in all these ones. Do you know them or not? Do you know that D-ala is vancomycin? Do you know that 30S is deoxycycline and aminoglycosides? Do you know that 50S is the C, clindamycin, macrolides, and the chloramphenicol? Do you know that RNA polymerase is rifampin? Do you know that DNA gyrase is fluoroquinones? So do you know these facts or not? If you don't know one of them, if you don't know one of them, make a flashcard out of it. Okay, guys? So that's very important. Now, let's try to see another question here. That's biostats, so it's not that important. Um, yeah, let's do this because that's an endocrinology. Endocrinology is the most important. It's the most important system on the exam. Lots of students think that endocrinology is not that important. Endocrinology is extremely important, guys. If you can answer the endocrinology questions right, this is like 10, 15, 20% of the exam. Okay. And then if you can also answer this microbiology and the pharmacology right, you only need few pathology here and there and you will pass the exam. Endocrinology is extremely important. Okay. So let's read it with each other. So what do I do? It's a big question. I already know it's endocrinology because I took a peek at the answer choice. Here there is no last line. The last line is pathophysiology process. The last line is actually the lab values. So here I just take a peek. Autonomous secretion of parathyroid, decrease alpha-1 hydroxylase, defective parathyroid, surgical. I know they are talking about a parathyroid hormone. So I know probably this person is having a calcium or phosphorus problem, and they are trying to find if I know what's the cause of this. So these questions need my full attention. So I will read it in details and try to find anything I can find that's helpful. I try to highlight it. So a 62-year-old man comes to the physician for a follow-up visit. He has a 20-year history of type 2 diabetes and hypertension. Over the last 4 months, he has experienced progressive fatigue, generalized bone pain, and persistent itching. His current medications include metformin, glipizide, and lisinopril. On physical exam, his blood pressure is like this. His pulse is this. He appears pale, and there is multiple linear excoriation on his forearms and the trunk. Probably this is important. That being pale and being multiple linear excoriation, this can be important. And probably I already know that 20-year history of type 2 diabetes was also important, and I forgot to highlight it. Okay, because probably his diabetes is not controlled. So let's read it. His sodium is fine, potassium is a little bit high, to 0.2 high, and bicarb is fine. Creatinine is wow, 4.2. His creatinine is skyrocketing. So probably I know the first thing is that this person is probably is having chronic kidney disease from his diabetes. Something I need you to know, guys, diabetes can cause kidney damage. That's one of the microvascular complication, and you can prevent it by giving ACE inhibitor, but it doesn't always prevent it. Okay, this person is already taking ACE inhibitor. Calcium is low, phosphorus is high, BTH is high. They're asking what's responsible for this. So right now, I know this person is having kidney damage and the low calcium and the high phosphorus and the high parathyroid hormone. So the first thing, high parathyroid hormone, this person is having hyperparathyroidism. Okay. Now the second thing is that it's a kidney damage. Once I see kidney damage with too much parathyroid hormone, I know right now it's a secondary hyperparathyroidism, guys. This person is having secondary hyperparathyroidism. So let's try to read the answer choices with each other here, and let's try to figure out what is this, because he has low calcium and they have kidney damage. How do I approach this question? First, I ask myself, what happens if you have kidney damage? If you have kidney damage, you will get what? You will not be able to secrete phosphorus. That's the first thing. So you will have too much phosphorus. You can't get rid of it. The second thing, Noor, is that also if you have kidney damage, you will not be able to activate vitamin D. Isn't this correct? So you will have decreased vitamin D. So you have two things right now that happen in kidney damage. Phosphorus cannot be secreted because your kidney cannot secrete phosphorus or potassium, and the vitamin D is decreased, the active form of vitamin D, because you don't have the enzyme 1 alpha hydroxylase. That's the two things that happen. Now you will tell me, okay, what's next? If you have too much phosphorus, guys, this will bind to the calcium. So it will decrease the calcium level. Okay. And if you have low vitamin D, what's the function of vitamin D? It's to absorb calcium and phosphorus. So if you don't have vitamin D, this will also decrease the calcium. So you will get low calcium. So again, in kidney disease, you have too much phosphorus, too little vitamin D. And the both of them will cause low calcium. Now, if you have low calcium, what will happen to the parathyroid hormone? The parathyroid hormone will increase to try to compensate. And that's called secondary hyperparathyroidism. So what's the most likely responsible for this patient laboratory? Is it autonomous secretion? No, and I will tell you why. It's not autonomous secretion. This person just have too much parathyroid hormone, but his calcium level is still low. That's called secondary, and it doesn't happen from autonomous secretion. Autonomous secretion means hyperplasia. Is it decrease 1 alpha hydroxylate activity and phosphate retention? Probably. We said it happens from decreased vitamin D because you don't have the enzymes that activate it, and from phosphate retention because you can't secrete it. So let's put B here. Is it defective parathyroid hormone receptor in the bone and the kidney? What? If you have defective parathyroid hormone receptor in the bone and the kidney, like I don't think it's even related to the kidney damage. I don't think that even chronic kidney disease can cause this. So I wouldn't say it's correct. Is it inadequate dietary intake of cholecalciferol? Cholecalciferol is vitamin D. If you are not taking a vitamin D, what will happen? What will happen is that you will have decreased the calcium and decreased the phosphorus because vitamin D absorbs both of them. This person has high phosphorus, so it's the wrong answer. Okay? Yep. Low both of them, Osama. Is it post-surgical destruction of parathyroid gland? So if you undergo thyroidectomy, sometimes you can remove the parathyroid gland. And this can give you low calcium and the high phosphorus, yes, if you have if you removed the parathyroid gland. But what will happen to the parathyroid hormone level? It will be low because you removed the parathyroid gland. This person has too much parathyroid hormone, so it's also wrong. So the only one here is B. Now let's go back. Why not A? Autonomous secretion, guys, is something called tertiary hyperparathyroidism. It happens after years and years of having chronic kidney disease and having this parathyroid hormone being elevated too much. Okay, guys? This parathyroid hormone, when it's elevated, it start to go up, 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 too much, to the point it would be autonomously secreted, to the point it will increase the calcium level. And that's called tertiary. So tertiary happens years after kidney disease, and the only difference between secondary and the tertiary is that tertiary will have too much calcium. It will increase the calcium ultimately, but secondary have too little calcium. Okay, guys? So that's the few things I wanted to highlight here. So the answer would be decreased hydroxy activity. It's not A. But again, maybe I am wrong. Maybe the answer come back as A. So I will submit my answer and I will make sure I am correct. Okay, Mama? Now, do I memorize these reference values? That's a very important question, Carolina. I would say yes. I usually memorized the sodium, the potassium, the bicarb, and the calcium. And I know phosphorus is like about 4 to 3, so 6 is extremely high. I know parathyroid hormone is extremely high. So I am memorizing the main stuff that I will always see each day. Okay, the sodium, the potassium, the bicarb, yes, Noor, the calcium, these things. I know the calcium, for example. I know the upper limit is 10. The lower limit is about 8. So I try to memorize them. It will save me too much time on the exam. Okay, guys? Okay. Now, how do I use this Anki efficiently or the flashcards? I do it for the ones I don't know. So some of you guys, you didn't know, for example, that in chronic kidney disease, the phosphate level will be elevated. So that's an important one. So probably this one here, chronic kidney disease, the serum phosphate will be elevated, is important. So I will try to add it to my deck. So I will try to add it here. I will make a deck, and let's say I will call this deck, for example, um, no, endocrinology weak points. Okay. And I will create it and I will make this weak points for me so I know that I am getting this wrong. Okay. No, I never recommend first aid, Noor. First aid is useless right now because not useless, but it has many informations. It's about 800 page, and you don't know which ones are high yield, which ones are not. So do you know what you end up doing? You end up studying everything the same way. So you study something that's extremely low yield in one day and another thing that's extremely high yield and also another day, and that's not efficient. That's why I recommend doing UWorld or Synapse, for example, and doing Anki cards if you need, maybe as Monstra said, for review, for example. Okay, guys? So that's a few things here and there. Thank you so much, Rosario. And let's see, we still didn't finish yet. Let's continue, guys, and I will show you how do I do this type of stuff, okay? So this one I already know the answer. So UWorld or Synapse, which is the QBank we are answering right now in Melda, okay? That's the QBank, but it's only for step one. The step two one will be released in 2 to 3 months. It contains the most high yield 300 informations, okay? I always recommend doing pre-made decks. I always recommend doing your Anki cards, guys. Doing a specific Anki card that other people have made will take too much time and it's not worth it right now. So always do your Anki cards, not the pre-made decks. Okay, do not do the pre-made ones. Pre-made nor means another person have made it and you are already doing it. Okay. Now let's do it. Let's do it. Maybe we can continue the other questions, guys. Okay. So let's see. Let's see. Okay. So yeah, you can find many tutorials, Faisal, on how to make these Anki cards. For Synapse, it's pretty easy because it's already integrated. You can just add it right now, like we have done here. So let's see another one, guys. Okay, this is erythromycin. Can you see? Because I studied the antibiotic very well in the previous one. Right now, I know erythromycin is a macrolide and it's a 50S subunit. Oh, but probably I didn't study it extremely well because erythromycin, there is no 50S subunit in the answer choices, but there is tRNA. Maybe it's this one. Oh, it's wrong. Oh, it's an inhibition of protein translocation. Can you see what happened, guys? I didn't study it very well. I didn't understand it. And that's the difference between memorization and understanding. Because you asked me, do I memorize or understand first? You need to understand first, right? So when they asked about erythromycin, if I memorized it, I know it's a 50S subunit. It inhibits the 50S subunit. And I got it wrong because there is no 50S subunit in the answer choice. Right, guys? But how about if I understood it, Muhammad? If I understood it, I would know that erythromycin here inhibit the 50S. But what is even the 50S? The 50S is a subtype of ribosome. Ribosomes are made of 50S and 30S, and these ribosomes are important to make protein in protein translation. So I now know 50S and 30S, when you inhibit them, you will prevent the protein translation. Now I understand it. So if I understood it, I would have answered this question right. But because I didn't understand it, I didn't even know what is this 50S, what is this 30S, so I got the question wrong. So guys, please always try to understand the question. Right now I got it wrong. Okay. So right now I will try to answer all the Anki cards for this question and I will try to answer it all and I will add it to my deck and I will try to answer it very well, guys. Okay, so that's very important. Now, let's see another question, Muammar, here. Okay, so here. Wow, a very large question. Okay, a very large one. So that would be extremely good to tell you how do I time manage this question. I will show you, I will answer it directly and I will show you guys how I am thinking. So I will not read it from the start or anything. I will tell you how I actually do it. Okay, so what I will do first, I will read the answer choices very fast. So it's an autoimmune mediated demyelination of the peripheral nerves. That's Guillain-Barré distal axon degeneration due to neurotoxic metabolite. Okay, that's probably peripheral neuropathy. Impaired absorption of a cofactor in terminal ileum, that's probably B12 deficiency. Intracellular accumulation of sorbitol, that's probably like cataract. Ischemic injury to nerves due to fibrinoid necrosis, that's probably diabetes mellitus. Spinal nerve root compression due to intervertebral disc, that's so they're asking about neurology. I know now it's neurology. Okay. And I already know it's in neurology because we made neurology too long like this to stimulate the exam because the exam neurology is extremely long. So let's read it. So what I do is that, oh, when asked to stand with his feet together and the eye closed, the patient begin to sway and require the physician assistant to prevent falling. I know that's called the Romberg sign, and I know it's probably dorsal muscle weakness or dorsal root ganglion weakness. I know it's a dorsal column affection. So I know it's maybe a spinal cord problem with a dorsal column affection. Okay. Um, there is no evidence of muscle atrophy or focal motor weakness. Okay, I know it's a dorsal column affection. I will try to read the remaining questions, but I know it's probably something that affected the dorsal column. So what's the remaining question here? This person, 58-year-old, retired accountant, present to the clinic for appointment. During the review of systems, he mentioned that he has been experiencing unusual sensation and occasional discomfort in his lower extremities. So it's lower extremities. So I will draw this person, and I know it's lower extremities. For the past 8 months, he knew that the discomfort is often more noticeable at night when he is trying to sleep. This can be restless leg syndrome, but I don't know for sure. His past medical history is significant for diabetes, diagnosed 12 years ago. So probably he has uncontrolled diabetes, benign prostatic hyperplasia, GERD, and hypothyroidism. Okay, so probably he's also having autoimmune condition. He underwent an appendectomy at age of 15. He takes metformin, which he admit to taking whenever he remembers. So he is not taking metformin very well. So probably this person is having problem in his diabetes control. That's the thing. Okay. He takes tamsulosin, that's for benign prostatic hyperplasia, omeprazole, that's for GERD, metformin, and levothyroxine for the hypothyroidism. He's a former smoker. He drinks. Everything else is fine. Respiratory is fine. Neurological exam shows decreased pain break and temperature. So it's not only the dorsal column, it's not only vibration, it's probably also pain and temperature. So I know right now, I try to draw a map. This person has problem in sensation, where in both fields extending to mid-calf. So it's usually distal sensation problem. I associate it with what's the vibe of the question they are trying to tell me, that they are trying to tell me right now that he is having uncontrolled diabetes with distal sensation problem. So probably he has peripheral neuropathy from diabetes mellitus. So I already know the answer. That's a peripheral neuropathy from diabetes mellitus. Okay. I will continue. Vibration is diminished. Patellar reflex are plus 2. Ankle jerk is absent. And I already read this part. So let's read. Autoimmune mediated demyelination of the peripheral nerve. That's a Guillain-Barré. Guillain-Barré. But Guillain-Barré, would it affect the peripheral or the distal leg? Yes. But does it cause motor or sensory? No. What do you guys think? Does it cause motor or sensory? What do you think? Mostly what? Mostly motor, right? Mostly motor. And does it present for the past 8 months? What do you think, Tyre? What do you think, Sarah? Or does it present only after Campylobacter infection and it's subacute for 1 week, 2 weeks? It wouldn't present for 8 months, right? So that's very important, Sandy. So this is wrong because it's not motor and it's not for 8 months. It can never be this. Yes, it can be after Campylobacter or cytomegalovirus. Amazing answer. So that's wrong. Is it distal axon degeneration due to neurotoxic metabolites? What is? I didn't even know this. So I don't know this answer. Would I choose it? I wouldn't choose it. I don't know it. I will not choose it. But I will highlight it so I study it after I answer the question. Is it impaired absorption of a cofactor in the terminal ileum? That's B12. Can B12 cause peripheral neuropathy? Yes. But is any risk factor for B12? No. Like B12 can happen from metformin use, but this person is not even taking his metformin. So it's not the probable diagnosis. So it's not the probable diagnosis. Okay. Intracellular accumulation of sorbitol, that's a cataract. No, that's a cataract and no. Ischemic injury to nerves due to necrosis of the arteries? It can be it. Maybe. So I am suspecting D or E because D also happened from diabetes mellitus, by the way. D happens from diabetes accumulation of sorbitol because diabetes will have too much glucose that accumulate into sorbitol. But E also happen from diabetes because diabetes can cause ischemia of the arteries that supply the nerves. It can cause atherosclerosis or arteriolosclerosis of the arteries supplying the nerves and cause nerve damage. So it can be both of them. But which one is more probable? Maybe E is more probable. So what do I do in these questions? I choose the most probable one, the most direct one. Okay? Even if it's the wrong answer, I have a valid reason to choose it. So I am confident to choose it. Okay? Do you know, guys, if it's the wrong answer and actually the answer would be D, then it would be very hard question on the exam. And if it's a hard question on the exam, there is a high probability that first it's an experimental question, so it will not have too many, like it will not be even counted. And sometimes the hard questions on the exam, guys, will have low points. It doesn't have high points. And that's why I always tell my students, treat any question on the exam as direct questions. Because if it's a direct question and you got it wrong, then most of the other students got it right, and that's bad for you. You need to answer the easy questions right. I don't care about you answering the wrong questions. And something I have done myself on my step 2, I didn't answer or I was not focusing on answering wrong questions. I was focusing on answering the direct questions. And on my NBMEs, I was having from 10 to 20 mistakes per NBME, and all of them was hard questions. And I was scoring on the NBMEs from 270 to 280. Why? Because it doesn't matter if you got the hard questions wrong. What matters is the direct ones that all people get it right, you also get it right. Okay? That's what will get you a high score on the exam. So don't focus on the very hard ones, I need to know them. You don't. Okay, guys? So here I will answer it direct. If it's D, then it's D. Then I will learn, and that's fine. Okay? So can you see? It's the wrong answer, but that's fine. Then it's D. Then I learn from it. Then I learn from it. I need to know two things right now. The first thing, why my answer here is wrong. Why it's an ischemic injury due to fibrinosis of medium size. Why it's wrong. I try to ask myself, is it because medium sized or is it because the fibrinoid necrosis part? And then why the other answer is correct? Because I thought cataract is the only thing that happened from accumulation of sorbitol. So I will ask myself these two questions and I will read the question with this intention. Why my answer was wrong? Why the other answer was right? Okay. So first, let's see here. Okay, so that's the pathway that glucose will be accumulating, and usually it will go into sorbitol, and this sorbitol will accumulate in three organs. I didn't know this. I thought sorbitol only accumulate on the retina and cause cataract. I didn't know the other ones. I didn't know it will also accumulate in the nerves and cause neuropathy. I didn't know it will also accumulate in the kidney and cause nephropathy. So that's the first part. I didn't know that sorbitol accumulation affects the three things: the nerve, the kidney, and the eyes in diabetes. So that was my first mistake. So apparently my reasoning was right. Apparently it was right. It was diabetes. But I failed at the last step. That's fine. That's fine. Okay. The other thing, why my answer was wrong. So let's see here. Ischemic injury due to fibrinoid of medium vessel arthritis. That's a polyarthritis nodosa. Oh, that's a vasculitis, guys. That's a vasculitis. Okay, that's not diabetes itself. That's a type of vasculitis that affect each organ except the lung, and it's associated with hepatitis B. So it's not even diabetes. Apparently, diabetes doesn't affect the medium vessels. Apparently, diabetes affects the small vessels, and that's why we call it arteriolosclerosis. So what should I do right now? I should learn from this, and I should also ask ChatGPT, please, why the answer E is wrong. I thought diabetes affect the medium vessels. I'm telling you how I was studying for my step two. Okay, so E is wrong. Why? Okay, they are telling me here. So E is wrong because ischemic injury and the fibrinoid necrosis is vasculitis. Okay, that's the first stuff. Okay, the second stuff, diabetes cause microangiopathy, small blood vessels, not medium vessels. So now I know why my answer was wrong, and it's actually a hard question, guys. And that's how I learn from my mistake, and that's how I answer these types of questions. Okay, so that's pretty good. That's pretty good. Now let's see here. Okay, always. So you can, guys, we can wait. So we can try to answer it with ourselves, and we can wait through the questions. So we can try to answer it with ourselves. Um, that was supposed to be the end. But do you want me to do more questions, guys? If you want me, I can do like more questions, like 20 minutes more. What do you think? If it was helpful. Okay. Okay, Rosie. Let's do more, guys. Okay, amazing. Let's do more. Okay, okay. Let's do few questions more. Okay. So let's see here. So let's pick other systems, okay? Because right now I am done, literally done with 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 the neurology and the micro. So let's choose other system, okay? So, yeah, to summarize how I answer long questions, Imelda. First thing, always, long stems are always extremely easy. Unless this one was hard question, okay? But long questions are always extremely easy on the exam, okay? The point of long questions is that they are too long to take or to waste your time, but they have many key factors to the point you can answer the question extremely easy. Can you saw this one? It has many keywords. So while I am reading, I am not trying to think about each one. I am trying to see the big picture. So here while I am reading, oh, what's the vibe? What's the vibe of the question? So I read it at the end. I know it's neurology. Then I, with my eyes, very fast. Oh, he has diabetes. That's uncontrolled. Okay, okay, okay. What else he has? He has peripheral neuropathy. Okay, okay, okay. So I am not trying to read in details. I am trying to see what's the vibe, what they are trying to lead us, because it has too many keywords. That's the beauty of long questions. Short questions, they can be confusing because you don't have this much keywords. Okay, yeah. So I will bring a question that's similar to a step 2 one. Okay. That's similar to a step 2 question, guys. Okay. So here, which of the following is the most appropriate next step in management? That's a step 2 part, but it's important to also for step 1. So what I am doing right now, what I am doing, what do I do? I read the answer choices. Apparently, the last sentence here is not important. He have done a CBC and the metabolic panel 2 weeks ago. Okay. Which of the following is the most appropriate next step? Agree to order the CT scan to provide reassurance, prescribe a short course of benzo, reassure the patient to instruct him to return only to if symptoms worse, refer to psychiatric, or schedule a regular short interval follow-up. I already know this question is ethics. So let's see here. When I see an ethics question, do not read it in details. Try to see the vibe. 34-year-old man comes to the physician because he is convinced that he has pancreatic cancer. So I know right now maybe this person have a psychiatric problem. Maybe he has illness and anxiety where people are thinking that they have cancer or they have a specific disease but they don't. He reports sensation of fullness in the upper abdomen that he noticed 8 months ago. Of course, I know it's probably psychiatric because you would never see 34-year-old having pancreatic cancer. It's extremely rare in 34-year-olds. Okay, so let's continue and see. He spends several hours daily researching symptoms on the internet, checks his eyes in the mirror frequently for signs of jaundice. That's probably he read it from the internet. He has visited 3 other physicians in the past 6 months. He underwent ultrasounds. He has been frustrated that previous doctors haven't taken him seriously and request a CT scan of the abdomen to finally rule it out. And physical exam shows a soft, tender, non-tender abdomen and everything is fine. So yeah, this person has illness and anxiety disorder. He is believing that he has cancer. Extremely high yield to know this. How do I answer this question? If I already know the answer, I already know any person with illness and anxiety or factitious disorder, I need to schedule a regular follow-up with them with the same doctor. That's the only treatment or the only management. But let's say I don't know the answer. Let's try to reason it. Agree to order the CT scan to provide reassurance? Never. As a physician, you should never prescribe a radiological or a treatment if they are not indicated. So let's say the president of the United States came to you and tell you, I need to do a CT scan of my brain to make sure I don't have malignancy on the brain. Would you do it? No, never. So you have the right to refuse this type of stuff. So don't prescribe a short course of benzo. This will help him on his anxiety. But this person problem is long term. He has this problem chronically. So in order to treat it, you need cognitive behavior therapy, not short course. Wrong. Reassure the patient and instruct him to return only if symptoms worse, that you are not doing anything here. Because this person has a problem, you need to follow up. You can't just reassure him. Reassurance will not work. Refer the patient to a psychiatrist immediately. I will tell you something. For step 1, step 2, step 3, referral is almost always the wrong answer in psychiatry. Referring the person is the wrong answer always on the psychiatry. Okay? So that's wrong. So here it would be scheduling a regular follow-up. Okay, guys? And Here there is a good table differentiating illness from somatic and from conversion. Let's see another one. Let's see another one. Here it's not arteriovenous fistula. Here, that one is very important. For step one, step two, step three, they are asking about what type of immune deficiency. That's a very good question, and it's very good for test taking strategy. So I need you to focus with me, guys, because it has many answer choices. So that's pretty good. So how do I approach the question? Again, I read it from the last sentence. Laboratory studies shows markedly decreased CD3 count and CD19 B cell. So apparently this person have problem in his B cell and in his also T cell. That's the first thing. Which of the following is the most likely deficient for this patient? Right now, I can even answer the question without reading the full sentence because I know this person has problem in CD3 T cell and CD19. I know it's a combined problem. But let's read it from the start. Let's say they didn't show us this. Can I answer the question if they didn't give us this? Because right now it make it easy. Let's read and see. A 4 months, so first I know that they are asking about immune deficiencies. So let's read and see. A 4 months old boy is brought to the physician because of a 2 months history of chronic diarrhea and the failure to gain weight. Once I see either diarrhea or sinopulmonary infection like sinusitis or pneumonia, I know it's a B cell deficiency like IgA. Why? Because B cell is what protects your mucous membrane. So if you have B cell deficiency, you will get GIT infection and you will also get sinopulmonary infection. Okay, so I know the first thing this person has is B cell. He has been hospitalized for severe bacterial pneumonia, so B cell. Let's continue. He also had persistent oral candida. Wow, guys, oral candida or esophageal candida will be T cell deficiency. And I always tell my students, candida, if it's in the mucous membrane, oral, or esophagus, that's a T cell. If it's in the blood, like candidemia, candida in the blood, like endocarditis, this will be neutrophil deficiency. It makes sense. Please don't remember it. Don't we know that esophageal candidiasis can happen in HIV? And don't we know that HIV is a T cell deficiency, CD4 T cell? So it makes sense. Don't we know that oral candida, oral thrush, can happen when you take steroids? And we know steroids also decrease the CD4 T cells. So it makes sense. Mucus candida means oral or means T cell, either oral or esophageal. Blood candida means neutrophil. So now I know he has T cell and the B cell. So probably he is a 4 months old with T cell and the B cell at the same time. So probably he has combined disorders, severe combined immune deficiency. So I know this. But let's continue and see. Let's continue and see. And why I am continuing? I am continuing to make sure I got the question right. So physical exam shows a small ill-appearing infant with a weight below third percentile. This makes sense because it's a severe condition. The tonsils are not visible and also the lymph node. What's your tonsils and your lymph nodes, guys? Your tonsils and your lymph nodes usually are the organs that carries the B cells. So that's another keyword that he has a B cell deficiency. If there is no lymph node or no tonsils, it means he has no B cell. A chest X-ray shows a lack of thymic shadow. He doesn't have a thymus, so he also have T cell deficiency because the thymus is where your T cell mature. So that's another way to know it's B and T all together. So I know this person has SCID. Is it enough to know is it a SCID or not? No, I will tell you why. Let's read the options from the end to the first. WASP protein. What is this? WAS. So this Wiskott-Aldrich syndrome. What do I know about it? I know that it can cause decreased platelets and thrombocytopenia and eczema and also immune deficiency. This person doesn't have decreased platelets or eczema. So wrong. NADPH oxidase. What is this? This is usually chronic granulomatous disease, right, guys? So it will present with catalase positive organisms. Is Candida catalase positive? Yes. But are diarrhea and pneumonia caused by catalase positive? No. Diarrhea and pneumonia are caused by streptococcus, by poliovirus, by giardia, by these things. So they are not caused by catalase positive. So that's wrong. That's not chronic granulomatous disease. Is it IgA deficiency? Yes, it can be. But IgA deficiency will only cause diarrhea and pneumonia. It will not cause candida. So IgA deficiency here will only be selective. It's not the correct answer because it wouldn't explain the T cell this person has combined. So wrong. IgA deficiency, guys, usually cause recurrent giardia infection and anaphylaxis of blood transfusion. I always remember IgA, so anaphylaxis was A, and the recurrent giardia infection was A. So it's wrong. Okay. Is it hypoxanthine guanine phosphoribosyl transferase? When I don't know a long name, I always try to abbreviate it. Okay. H G B B R T. That's HGBRT deficiency. That's usually a disease, as Anthony said, called Lesch-Nyhan syndrome. Okay, guys? And this one has nothing to do with immune deficiency. It's an X-linked, so it affects the boys, and it usually causes too much uric acid and severe aggressive person, severe aggressive boy. So it wouldn't be the right answer. Is it CD18? That's leukocyte adhesion deficiency, CD18. This one will cause what? This one will cause delayed separation of the umbilical cord. That's the keyword. So CD18 is leukocyte adhesion deficiency. The leukocytes cannot adhere and migrate to the site of infections, and it will cause a keyword you will always see it on the exam called delayed separation of the umbilical cord. So wrong. Is it BTK, proton tyrosine kinase? No. This one will cause decrease in B cells. It's called agammaglobulinemia. Okay, agammaglobulinemia. And this one decrease B cells only. It doesn't decrease anything else. Okay, so this person has decreased B cell but also T cell. So it would be wrong. Is it ATM? ATM. ATM means ataxia telangiectasia. So this one for ataxia telangiectasia. Can this one cause immune deficiency? Yes. But it will also cause ataxia and telangiectasia that's similar to basal cell carcinoma that we have seen. So wrong. So what's left with us? What's left with us would be adenosine deaminase. And even if we didn't know that SCID can happen from adenosine deaminase, we could answer this question with excluding the other answers. Can you see, guys? And that's why I always tell my students you have two ways of answering questions, excluding other answers or already know the answer. So SCID here, as you can see, Maria, can be caused by adenosine deaminase deficiency. That's the autosomal recessive part of SCID. And they can also be caused by interleukin-2 deficiency, and that's the X-linked part. Karim, I don't know the inheritance of immune deficiency. You don't need to know. Adenosine deaminase is autosomal recessive. There is a disease called the Job syndrome, is autosomal dominance. Any other immune deficiency will usually be X-linked. Chronic granulomatous, X-linked. Hyper IgM, X-linked. Bruton, X-linked. Any Wiskett-Aldrich, X-linked. So don't try to remember the immune deficiencies. Yes, most enzyme deficiencies are autosomal recessive, but for immune deficiency, Anthony, adenosine deaminase is the only autosomal recessive. Job is the only autosomal dominant. Any other immune deficiency disorder is X-linked disorder, guys. Okay. Now, another question. Can it be diGeorge? So diGeorge is absent third and fourth pharyngeal pouch. And it can cause problem in the thymus. So it can cause absent thymic shadow, right, guys? But it will also cause problem in the parathyroid hormone. So it will cause decreased calcium level. Okay. It will also cause, and that's very important, a problem in the heart. So it will cause tetralogy of Fallot. Okay. And it can also cause problems in the face. So it can cause facial abnormalities. And that's why the George is wrong. This person has only immune deficiency, no hypocalcemia, no heart problem, no facial abnormalities. So that's why the George will be the wrong answer here. Okay. Two questions. The first question, okay. Uh, do not focus on the hard questions that much. I always tell my students in your world, if you see a question that 30% of people have answered it correctly, then this question is not important and not high yield. Do not take too much time on it. Just go very fast into it and move forward. But imagine you see a question like this, and let's say 80% of people answered it right, but you got it wrong. You got it like CD18. This one you need to review it very well because it means that 80% of the students know this question. So this question is high likely to show up on the exam, and if you got it wrong, it will hugely affect your score on the exam. So please, guys, give attention to this easy and medium difficulty questions that you are getting them wrong and the other people are getting them right more than the hard ones. That's pretty, very important. Okay. Now, how do you remember this type of stuff, Noor? So again, immune deficiency depend on two things. That's just an example. It depends first on me trying to answer these questions, understanding it, because I need to understand the types of infection and I try to visualize it into my head. Then the memorization part will come with time. So only time will fix this memorization for you guys. Only time will be the one that fixes this memorization for you. Okay. Of course, here I will read why each answer choice is wrong. Okay, guys? And I will try to also go through this high yield concept to figure out, oh, what is DiGeorge, for example, the catchy 22? What is Job syndrome? What is candidiasis? What is a skit? What is the hyper IgM? What is Wiskott Aldrich? What is ataxia? What is like Laryngeal? What is it? I believe these things are high yield. Very important to read these type of tables, guys. Okay. Um, yeah. Again, if you want exceptional score, I will tell you my experience is that I finished my exam, and in my step one exam, I didn't remember any question on the exam, guys. So on my step one exam, I usually remembered only one block that all of them was very weird answers. They were literally asking me, for example, about a person that have went into the space and what would be the changes of human body in the space, for example, some weird things. That's for step two experience. And for my step one experience, sorry, okay, like literally very weird questions. Should I panic? No, because I go with the mentality that first 33 of the questions are experimental. So it's a pretty clear that I will see half of the block or even 30% of it, I will not be able to answer it. So you have to compromise with yourself with this fact. That's pretty important because I don't want you to go into the exam and panic once you see that, oh, like, I don't know. Literally, I was flagging 15 questions per block for step one and also for step two. Okay. So that's the first part. Do not panic when you see hard questions. The second part is that always trust your NBMUS scores. If you get 70% on the NBMUS on step one, that means you will pass the exam, right? It's like 99% chance. So always trust these scores because these scores are extremely accurate, guys. Okay. The third part is that keep in mind that other people will also underperform. So don't say, oh, but I will score that good in the NBME, but then the exam will be very hard. So I will underperform on the exam and I will panic. No, They are making sure when they do this NBMEs that this NBMEs reflect your exam experience. They know that most people will underperform on the exams. Okay, so that's pretty normal. The third thing, guys, okay, and that's pretty important, is that after my step two, I have remembered 280 questions on the exam. Of course, I deleted all of them after I remembered them, but I remembered 280 questions on the exam. 24 of them was wrong. And I was pretty sure I will not score this high. I was pretty sure I will score 250, maybe 260. Okay. Because I got 24 questions wrong out of 280 questions wrong. Okay. But again, out of this 240, 20 of them was very hard questions. Only four was pretty easy dumb questions that I have done incorrectly. But out of them, 20 was very hard, right? Or maybe three dumb questions. And that's why these hard questions probably they didn't even count on the exam. They didn't count them on the exam. And that's something very important. Okay. So please, guys, you will see these weird questions in the exam. 33% of the questions of them are experimental. 33%, literally. Third of the questions. Okay. Now, another thing is that, yeah, that's the thing. The main way to get an exceptionally high score on step two and to pass step one safely is doing too many questions. Do not try to go through like books, read books. Because have you seen when I was doing the questions, guys? Okay, like for the ones I told you to do it fast. The reason I was doing it fast because I have already seen these questions before. In my step two exam, I didn't sleep. I slept for 5 hours because I was panicking. Okay. And when I went into my exam, the only thing that saved me is that I was answering this exam and I felt like I have seen these questions and answered them multiple times during my prep. So, oh, like this is, oh, I know that's the question of aortic dissection. I already know what they literally will ask. I know they will ask either about the risk factor, hypertension, or they will ask about the management. So I have to see if they are stable, it would be CT angiography, or if they are unstable, it would be echocardiograph. So that's what saved me, is that I answered too many questions to the point I know the pattern itself. Okay, so focus on doing questions, guys. Okay, so that's very important. If you have 6 months of prep, if you have 3 months from 6 to 3, it's always doing the questions. If you are not understanding anything, then try to either ask ChatGPT. Also, having a tutor would help because a tutor will go with you through only your weak points. For example, me or any of our amazing tutors, guys, we usually do tutoring, and you can try us for 1 hour first. And usually we go through only your weak points or your weak points on the NBMEs or making a plan for you. Also, we have a 7-day USMLE crash course. And in this one, we go through 80% of the most high yield stuff. Me personally, I teach it, and also other students, also other amazing tutors that score 270 plus are also teaching this crash course. So these are just things can help. I believe doing questions is the most important stuff. Then you can either help ChatGPT or doing the crash course or doing tutoring, guys. Okay, that's most of it. Um, so definitely you will be able to overperform on your exam. One of my friends, and he is right now also a tutor, he told me you will score 1 point above your highest NBME, and he was correct. My highest NBME was NBME 14, it was 278. I scored 279, 1 point above it. And I even underperformed. So that's why, guys, if your NBME is 250s with the good strategies, okay, good preparation, good sleep, knowing some facts about, like, for example, the patient ethics, all of this stuff can get you to the 260, okay? So you will overperform, guys. Just try to believe in yourself and just to try to go into these exams with a calm heart. Okay, that's what I believe. So thank you so much, guys. It was an amazing session. It was an honor to be meeting with all of you. Oh, let me share the link for the community also, and the link for the WhatsApp community itself. Okay, so you know it, guys, and you join it. So I will be in this WhatsApp community if you like. So that's the link for the WhatsApp community here. Hopefully, I will see you again. We will be doing these webinars every 1 week, me and the other amazing tutors. Hopefully, I want to see you again. Did you know, guys? I wasn't planning to make this webinar, but then some students asked me about test taking strategies. I usually it's my first time to actually test like teach test taking strategies in an actual session. Usually I do it while I am teaching other concepts. Okay, so and the recording will be on our YouTube channel, the Match Guy Tutoring YouTube channel. I can also send you the link for it right now, so you can see it, guys. It has also the link for the hematology and the neurology. I am not saying this, but if you don't know about the neuroanatomy, either for step one or step two, or about the hematology, guys, watch this one. I believe it would be extremely helpful. Okay, so that's the YouTube channel here. Okay, we will be uploading also this webinar. Okay, always more new questions, tester. Always more new questions are better than doing the incorrect or the second round. Thank you so much, guys. I will see you later on, hopefully, and I will miss you because I believe some of you have witnessed me or have attended with me more than one time. Thank you so much. You are amazing, guys. Thank you. Bye bye.